Start.
A very good afternoon, one and all. I am Dr. Avanthi, consultant obstetrician and gynecologist from Lotus Hospitals, Siripuram, Visakhapatnam. Starting the PPT. So pregnancy అనేది just a second. Pregnancy అనేది it's a phase where your body's nutritional demands increase. So there's a lot of myth surrounding the dietary requirements, the supplements that need to be taken during pregnancy. So many women, they get their advice from their friends, from family, from social media. They start a lot of supplements altogether, like iron, calcium, probiotics, protein supplements. అన్ని కలిపి తీసేసుకుంటూ ఉంటారు అండ్ దే డోంట్ నో ఎగ్జాక్ట్లీ ద డోసేజ్ ద రైట్ వే ఆఫ్ టేకింగ్ దెమ్. సో ఇట్స్ నాట్ జస్ట్ అబౌట్ టేకింగ్ ద మెడికేషన్ అండి. ప్రెగ్నెన్సీలో యూ నీడ్ టు టేక్ ఇట్ ఇన్ ద రైట్ వే at the right time and in the right dosage. If that is not there, when taken all together, one supplement may reduce the absorption of another. Sometimes it may cause some side effects, and at times it may even harm your pregnancy also. So knowing how to take the supplements, what supplements to take, and at what dosage to be taken, and at what time need to be taken to maximize their beneficial effects is very important. So let me guide you through this in this session today. So iron, calcium and other supplements, are you taking them correctly? So first we'll start with the most common supplement that many of the Indian women require, and that is iron. About 60% of Indian women are anemic, and pregnancy lo iron requirement anedi increases because the blood volume almost doubles in pregnancy. So iron supplementation anedi almost man under pregnant women ki starting from their second trimester we recommend them to start taking iron. So iron, it is crucial for hemoglobin and oxygen transfer between mother and the baby. It prevents anemia, and fatigue is excessive weakness that may be there in pregnancy. Anemia may increase your chance of having a preterm birth. So taking iron supplements indirectly prevents this preterm birth risk during pregnancy. It builds up the fetal iron stores also. For the first 6 months, baby's hemoglobin also is supported by the mother's iron transfer during pregnancy. So the pregnancy to తీసుకునే iron supplements అనేది it is important to build up the fetal iron stores also. Deficiency of iron may lead to your reduced immunity, increased chances of having infections in pregnancy, increases your chance of having preterm births, increases your chance of having a low birth weight baby. And post delivery recovery కూడా మీకు డిలే అవ్వడం అనేది జరుగుతుంది. So taking iron supplements during pregnancy is of importance. So let us know how it needs to be taken. Iron is a molecule that needs acid for its absorption. So iron needs to be preferably taken on an empty stomach. If you're taking it on empty stomach, if at all you're feeling gastritis, you can take it about 2 hours after food. So you can take it between your breakfast and lunch at around 11 o'clock. And if you're taking it with vitamin C, like a glass of lemon juice, kanivandi, orange to part of teaspoon, this vitamin C will increase the absorption of your iron. Again, tea, coffee and milk, they have certain compounds which will block iron absorption. So iron తీసుకుంటున్న 1 to 2 hours ముందు వెనక టీ కాఫీ తీసుకోవడాన్ని అవాయిడ్ చేయండి. The amount of iron, it depends on your hemoglobin status, but in general as a supplement form we give about 100 mg of elemental iron per day. But in case మీరు anemic గా ఉన్నారు, your hemoglobin is less than 9, we might ask you to take higher doses of iron. So for individualized dose, you might have to consult your obstetrician. but 100 mg of elemental iron is the usual recommended supplement dose by the Government of India. Common గా iron తో మనం చేసే మిస్టేక్స్ ఏంటి? నెంబర్ 1, టేకింగ్ ఇట్ విత్ కాల్షియం. Iron and calcium మనం మోస్ట్ కామన్ గా ఇచ్చే సప్లిమెంట్స్, బట్ వెన్ టేకింగ్ టుగెదర్ calcium will prevent the absorption of iron. So definitely iron needs to be taken as a standalone medication separately from calcium, preferably on an empty stomach or after 2 hours of food. Many older preparations of iron, for that matter, the newer preparations are much better, Andy. But the older preparations of iron, many of them, they cause gastritis, they cause black colored stools, they might increase your gastric irritation. So dani valna many women, they tend to stop iron, they tend to skip the dose. Never do that, Andy. If you are not able to tolerate one particular composition of iron, you can get back to your obstetrician. We will change the composition, where a kind of molecule of iron is istamu. You can try that. You can take it with a glass of lemon juice to improve your absorption. Ledu appatiki tolerate cheyalekpotunnaru, you are becoming anemic ante we might even give you IV iron injections kuda ivvadaniki scope untundi. So don't just skip your dose in case you tolerate cheyakapothe. There are multiple other ways which we can give the iron formulation. So just talk to your obstetrician. If you are not able to tolerate one particular brand, maybe then you can consider switching to other brand. If you are not tolerating oral iron at all, with an absorption level with an issue with it, we might have to give you iron in an IV form also. So don't stop iron on your own even though you have some gastric symptoms. Sometimes constipation undachu, so increase your fluid intake, increase your fiber intake. So constipation relieve avutundi. Black colored stools unnayani kontamandi aapestaru. It just means iron is getting absorbed. So black colored stools is normal. It is not a side effect. You don't have to worry about it. Gastritis undi ante you can take antacids separately, not along with iron. Antacids separate గా తీసుకుని ట్రై చేయండి, లేదా కాంబినేషన్ మార్చి ట్రై చేయండి. అప్పటికి సెట్ అవ్వకపోతే IV iron you can consider, but don't abruptly stop iron. So this is about iron in pregnancy. Next, coming to another common supplement that we usually give is calcium. So why is it essential? Because calcium again is a major part of your bones, both your bones and the fetal bones also. So calcium supplementation in pregnancy is needed for fetal bone development. At the same time, it prevents bone loss from the mother's skeleton also. Calcium along with vitamin D is proven to reduce risk of hypertension and pregnancy lo వచ్చే BP risk ని తగ్గిస్తుంది. Calcium is needed for neuromuscular function and calcium demand అనేది ప్రెగ్నెన్సీలో పెరుగుతుంది. So along with food that is rich in calcium like ragi, milk, eggs, you can have these drumstick leaves which are good sources of calcium in pregnancy. You can consider adding them to your diet in a routine day-to-day manner. Along with that, you will need an extra 1000 to 1200 mg of calcium per day. It is ideal to take it in divided doses, say about 500 mg twice a day rather than taking 1000 mg together. And calcium is a molecule that is very well absorbed on full stomach. So calcium is best taken after your lunch or after your dinner. So after meals తీసుకోవడం వల్ల calcium absorption అనేది better గా ఉంటుంది. And if you're taking it with vitamin D, again calcium absorption is higher. So you can most of the calcium formulations they have vitamin D combined in them in general. Later, if you're taking a calcium formulation that doesn't have vitamin D and you're taking vitamin D separately, take calcium and vitamin D together. Never take iron and calcium together, but calcium and vitamin D you can take it together. So calcium, divided doses of 500 mg twice a day. After food, ideally after lunch or after dinner, vitamin D తో కలిపి తీసుకుంటే absorption better గా ఉంటుంది and regular intake అనేది needed. So after calcium, if you can walk for 10-15 minutes, మీ constipation and bloating sensation కూడా తగ్గుతుంది. So again, repeating what I've already said, never take iron and calcium together. At least give a gap of 2 hours to increase the absorption of iron So plan your schedule accordingly. So ideally, I advise my patients to take iron either on empty stomach early in the morning. Ledu tolerate cheyaleకపోతున్నాను అంటే I advise them to take it around 10 to 11, about 1.5 to 2 hours after their breakfast, and after that at the lunch around 1 o'clock chestaru. After lunch I'll ask them to take calcium. So there is at least a 2-hour gap between iron and calcium supplements. Now coming to DHA. DHA is a relatively newer supplement that we are supplementing pregnant women with, but DHA is proven to have beneficial effects on the brain and retina development in the fetus. It also improves the cognitive outcomes in the fetus. That is, the fetal IQ is better. It reduces preterm risk, and it is important in the later half of pregnancy, usually post-TIFA. That is when, in the second trimester post-TIFA, is when I start DHA and DHA is nothing but omega-3 fatty acids, which we get from fishes. Usually marine sources nunchi vastayi. Even if you are a vegetarian, there are vegetarian sources of DHA also. So DHA is a fat-soluble supplement, so it is best taken after a fatty meal. So after dinner, తీసుకోమని చెప్తాం usually. And DHA at times can cause that fishy burp, or fishy odor ఉంటుంది. So when you're taking it in the night, even though fishy burps అవేమన్నా ఉన్నా కూడా night పూట ఉంటుంది కాబట్టి మీకు you won't be suffering from that. You are better tolerating it. So DHA is usually taken in the night after a fatty meal. A small word about vitamin D. Again, vitamin D deficiency is very common among pregnant women in India because we're not getting enough sun exposure. So vitamin D supplements usually separately we don't advise. Usually many of the calcium formulations contain vitamin D in them, but in case you are deficient in vitamin D and you are requiring a separate supplementation of vitamin D, again vitamin D is a fat-soluble vitamin. So it is best taken along with the fatty meal. Meal you can add some nuts, some ghee, some oil. Along with that meal, if you're taking vitamin D, the absorption is better. Coming to multivitamins, usually Indians have this obsession with multivitamins. Every pregnant woman that comes to me asks, "Madam, multivitamin supplementation should I need? Should I take?" But usually, if you're having a poor, well-balanced diet, your diet itself covers all the micro macronutrients. But in case you are unable to have a well-balanced diet, you might have some micronutrient gaps and like zinc, iodine. So you can consider taking a multivitamin. Again, it's not a substitute for your diet. Nothing can substitute a well-balanced diet. So in case you find some gaps in your diet, then you can add a multivitamin, but specifically look for the components of multivitamins. So vitamin A or retinol containing multivitamins, avoid change in pregnancy. Number 2, if you're already taking iron, calcium and folic acid, vitamin D separately, again using same duplication along with multivitamin, again it might you might use a higher dose of the supplement than what is needed. So avoid duplication. Or overlap చూసుకోండి. Check for the components. Avoid multivitamins with high doses of vitamin A. Avoid multivitamins again along with iron, vitamin D, calcium తీసుకుంటున్నప్పుడు duplication ఇదే మళ్ళీ ఉన్నాయి మల్టీవైటమిన్లు అనుకుంటే ఆ మల్టీవైటమిన్స్ అవాయిడ్ చేయండి. Individualize. Usually we don't need to supplement other than iron, calcium, DHA. But in case your diet is poor, you can consider taking it once a day after meals. So pregnancy specific multivitamins ni choose chesukodam marchipodu. Coming to folic acid. Folic acid is the first supplement that we give during pregnancy. Once you get a positive during pregnancy test, definitely when you visit the doctor, first supplement that we suggest is a folic acid, but ideally it is good to start folic acid at least 3 months prior to conception. Pre-conception time నుంచి కూడా folic acid తీసుకుంటే baby neural tube development, brain development కి చాలా help అవుతుంది. In case you have a high risk pregnancy like you're diabetic or you're on certain medication like antiepileptics మీద ఉంటే, you might even need a higher dose of folic acid. Usual recommended dose is about 400 to 600 microgram per day. But if you come into that high risk category, obese ka unna, leda you are diabetic on metformin, or you are on antiepileptics, we might, or you have a previous baby with neural tube defects, Down syndrome, we might need a higher dose of folic acid up to 5 mg. Starting ideally pre-conception, minimum of 1 month, ideally 3 months prior to your conception, and continue in the first trimester. And then 12-13 weeks varaku kuda folic acid is the major supplement that needs to be taken. Folic acid is a water soluble supplement, so it is ideally taken after a light meal or a meal. Usually after breakfast, after light meal, we ask women to take folic acid. There are active forms of folic acid like N-methyl folate, 4th generation folic acids that are available these days. So you can look for the active forms of folic acid and consider taking them. These are the routine supplements that we give: iron, calcium, DHA, and folic acid. Vitamin D plus or minus in case you are deficient. Multivitamin in case again your diet is poor or you have signs and symptoms of any micronutrient deficiency, that is when we consider a multivitamin. Now coming to special supplements that we give for certain groups of women. First one among them is ecosprin. Low dose ecosprin or aspirin is given for some women with risk factors like age more than 40 or previous history of hypertension, or previously they have a growth restricted baby, or they have twins, or they have an IVF conception. Previous they had or they're hypertensive. They have hypertension and then they got pregnant. They have diabetes and then they got pregnant. Ilanti high risk population lo we recommend ecosprin. Ecosprin is usually a blood thinner, is what we say in colloquial language. It's a blood thinner. It improves the circulation between mother and the baby. So placental blood flow, the blood flow between mother and baby is improved. So it has a good risk-benefit ratio and it is evidence-based. Usually low dose ecosprin we start for these high-risk women. And for certain women, mana NT scan tarvata we have women who are categorized as higher risk of preeclampsia or hypertension or baby growth restriction lo high risk vastundi. In such women, we increase the dose of aspirin to 150 mg also. Usual recommended dosage is 75. In high risk women, after NT, we might have to increase the dose to 150 mg. Ecosprin again is best taken in the night so that the blood flow is improved and the absorption is better. And at times, ecosprin can cause bleeding so some spotting ilantivi undachu. Ala emanna unte you'll have to stop the medication for a day and consult your doctor. Ecosprin can sometimes cause gastritis, gastric irritation undachu. So it's best taken in the night to improve the absorption. In case you're needing a surgery or you notice any bleeding, spotting, immediately stop ecosprin and consult your doctor. And whenever you are planning a surgery, don't forget to mention that you're on ecosprin. So usually it is started ideally heart rate establish avagane start chestamu in high risk population. Ledu ala mundu manam start cheyaledu ante once the NT scan is done and if you're falling into high risk category, that is when we start ecosprin, usually around 12 to 13 weeks. And it is continued till 36 weeks, usually given in the night time and especially in high risk cases, not routinely given for every other women. Now, the other not routinely used supplements, one vitamin D we've already discussed. B12 deficiency is usually seen in those who are vegan or strictly vegetarian population, and they might have a deficiency of B12. So if you fall into this category in pregnancy, please check your B12 levels. And ఒకవేళ deficient గా ఉంటే you might have to supplement with B12 as per your doctor's advice. లేదు ఒకసారి మనం హీమోగ్రామ్ చేసినప్పుడు ప్రెగ్నెన్సీలో we notice certain changes in the dimensions of your red blood cells. Those women also might need a B12 supplementation. And or some women might complain of pins and needle sensation, tingling, numbness during pregnancy. For such category women also, we suggest B12 supplementation, and that can be supplemented as per your doctor's advice. Coming to protein supplements, and protein intake during pregnancy definitely increases. We might need about 1.2 grams of protein per kg per day. So if you are about 60 kgs in weight, you will need about 70 grams of protein per day. And if you are able to supplement that protein in diet, you don't have to take a protein supplement. But if you're not able to consume so much protein, if you're strictly vegetarian, you have lesser sources of protein, or if the baby is slightly growth delay, growth restriction, or if the maternal weight gain is poor, or in certain high-risk populations like hypertensives, wherein the placental blood flow is less and the baby's growth is not very ideal. In such women, we tend to ask them to take protein supplements. Again, protein supplements, whey protein, today we have plant-based protein. Whey protein absorption is easier and better. Plant-based protein is again a very good source of protein. Don't take these gym proteins, and they are not made for pregnancy. They have higher doses of protein that, and they have other additives. So don't take these gym proteins in pregnancy. Consider pregnancy safe protein supplements. In case you have underlying kidney issues, do check your creatinine before you start taking these protein supplements. Coming to probiotics. Probiotics are good bacteria. So we don't usually give them for all, but if you are needing to take any antibiotics during your pregnancy, if you have diarrhea, if you have bloating, constipation, gut issues in pregnancy, you can consider taking probiotics. Again, probiotics are active bacteria basically. So they need to be maintained in a cold chain, number one. Number two, if you have immunosuppression, consider getting a specific consultation before you start probiotics. Number three, probiotics are better taken on empty stomach or after a light meal. They need your stomach to be little empty for better absorption. Can't be taken immediately after food. These protein supplements, B12 and probiotics are not routine recommended supplements. So individualize, and in case you need this supplement, get a doctor's consultation and only then start these supplements. So to simplify things, morning on empty stomach, or ideally on empty stomach, iron is better. If you're not able to take it on empty stomach, you can take it like 1 to 2 hours after your breakfast. Afternoon, you can take calcium. Around night, you can take DHA and ecosprin. If you have missed calcium, taking it in the afternoon, you can take it in the night also. Basically, there's no strict routine, and iron needs empty stomach. Calcium iron should not be combined together. These are the 2 points which I want you to remember from all this lecture that I have given. These are the most important points. If you forgot taking iron in the morning, it's okay. You can take it after your lunch, after 1-2 hours. If you forgot taking calcium in the afternoon, take it in the night after dinner. Just that calcium needs to be taken with food, iron needs to be taken on empty stomach. Iron and calcium should not be combined and taken. ఈ 3 points గుర్తుపెట్టుకోండి. కొంచెం అటు ఇటు అయిన టైం, డోంట్ మిస్ ద డోస్. Don't skip taking, and after breakfast మర్చిపోయాను, so I'm skipping iron for today. Don't do that. You can either take it after lunch, after 1-2 hours also, but just don't combine iron and calcium. So in case with these supplements you're noticing constipation, increase your fiber intake. ఒకవేళ ఏమైనా nausea, gastritis trigger అవుతుంది అంటే just adjust the timings as I was mentioning. Gas ready undi ante you can take it after food on empty stomach kaakunda just 1 2 hours after food you can consider it. Black colored stools, it is normal when you're on iron supplements. Um, you don't have to worry about them. It just means your iron is getting absorbed. Yeah. Other than this, one medication that we usually give in pregnancy is nausea medication. It's not a supplement, so I've not added it in the presentation. But then, obviously, in the first trimester, many women have nausea, vomiting. So we give them medication for vomiting. You don't have to tolerate your nausea, vomiting, and it is absolutely fine to take these medications to control your nausea. So whenever you're having the maximum nausea, like early morning they have maximum nausea. Some women have it in the evening. So whenever you have the maximum nausea, have these medicines at least half an hour before that peak time. Have it with a sip of water, and then after half an hour or so, you can have your food. So yeah, the nausea medications are one tablets that need to be taken before your food. Nausea medications and antacids, usually we give them before food. Iron also better be taken before food, but if not tolerated, you can take it 1 to 2 hours after food. Thyroid is again another supplement that needs to be taken on empty stomach. So this is it for today. If you have any questions, I am happy to answer. Hello, Andy. Yeah, I see a question here. Doctor, I'm 5 months pregnant and my hemoglobin is 9.5. I'm taking iron supplements, but still feeling weak and lazy. What should I do? Is this normal? Hi, Andy. Basically, hemoglobin of 9.5 is mild anemia. If you're already taking iron supplements, ensure compliance. I'm sure you're taking it daily. But just see that you are taking it, be compliant with the supplements. And number two, as I was mentioning, the timing of iron, not taking it with calcium, taking it with a glass of lime juice or an orange, not taking it along with tea, coffee, having a break of 1 to 2 hours between food and iron. All these changes will make a difference, and if you are following all these points, in spite of taking iron, your hemoglobin is still on the lower side. Check if you're having any absorption issues, which might be a reason for your giddiness and weakness. So you can either change the formulation of iron, or you can consider taking IV iron if needed. For 9.5, we don't usually recommend, but you can check the formulation, the absorption of iron. It's not normal. You can have mild weakness in pregnancy, especially towards the end of second trimester. But it is not normal to feel giddy, dizzy. So, in case, along with iron-rich diet, in case you are taking supplements in the right way but still feeling giddy, please do consider changing the supplements, taking it in the right way, or taking IV formulations of iron. Yeah, I'm 7 months pregnant, getting leg cramps at night. Is this due to calcium deficiency? Should I increase my calcium intake? Hi, Andy. Many women have these leg cramps, especially in the night during pregnancy. Yeah, calcium deficiency is one reason, but again, electrolyte deficiency is another reason. Being dehydrated is a very important reason for these leg cramps. So make sure you're hydrating yourself well. Any electrolyte deficiencies, especially magnesium deficiency, increases these leg cramps. So you can consider taking magnesium supplement along with calcium. Calcium intake, if you're already taking 1000 to 1200 mg of calcium, you don't have to increase your calcium intake. Dietary supplementation of calcium you can consider, and consider taking magnesium supplement for a few days or like 1 to 2 weeks, and improve your hydration. That is very important. And you can also consider doing some leg stretching exercises along with a consultation with our in-house physiotherapist. A few leg stretching exercises before you sleep in the night will make a lot of difference for leg cramps in night. I'm taking iron calcium regularly but still feeling tired and weak. What could be the reason? Weakness and tiredness, there can be many reasons other than iron calcium deficiencies only. So, see if your protein intake is ideal, if your hydration is good, iron calcium, if you're taking it in the right way, I need to know how much is your hemoglobin. All these need to be checked before I can give you a proper reason for your weakness. Little tiredness, weakness is expected in pregnancy, but if it's with activity, it is okay. But even at rest, you're feeling tired, weak. It is disproportionately very tired, very weak. You're feeling. Then do consider getting a consultation. Sleep disturbance can be a reason. Dehydration can be a reason. Anemia can be a reason. So, the multiple reasons for tiredness and weakness in pregnancy. Sometimes protein deficiency can be a reason. Check all these causes before correct these causes. If you're still not able to come out of it, look at the consultation. Doctor, I started taking iron tablets in my 4th month, but I'm experiencing severe constipation. I'm thinking of stopping the tablets. What do you suggest? I suggest you not to stop the tablets only. Again, increase your fluid intake, increase your fiber intake. That will prevent constipation. If in spite of that you are still noticing constipation, change the formulation of iron only. The newer generation of irons that have better GI response. So change the tablet brand. In spite of that, if you're still having severe constipation, as you've mentioned, you can consider taking IV iron, but don't skip or don't stop the tablets. I miss taking my supplements for 1 week while traveling. Should I double the dose? Please don't do that, Andy. Usually, whatever supplements are taken, the medications, they have the maximum RDA, the daily recommended daily dosage of whatever is the iron and calcium. You'll get it in the supplements. So you don't have to double the dose now. That might, the dose might be too high than what is needed. So just don't miss taking them from now on. Along with that, be good with your diet also. You don't have to double your dosage now. From here on, don't skip your medication. I usually drink milk in the morning and take my iron tablet immediately. Is this affecting iron absorption? Yes, please make sure you're having at least an hour gap between your milk, coffee, tea, and iron. You can take iron with a glass of lemon juice instead. I delivered 1 month ago. Should I continue iron calcium supplements? Very, very important question. Pregnancy, all of us don't mistaking these supplements because we're worried it might impact the baby. But once the baby comes out, all the attention goes to baby, and women tend to skip their iron and calcium. But postpartum is another phase which has a lot of demand on your body. So please don't stop taking iron calcium. It is recommended to take iron for at least 3 months postpartum, and calcium supplements, if you can take it till you finish exclusive breastfeeding for about 6 months. That your body is going to thank you for that later date. Your bones will be stronger, your back aches, leg pains, and all that will be less if you're taking proper calcium supplementation in postpartum phase. Please do consider continuing your iron calcium and also detection during postpartum phase. Ma'am, I'm 14 weeks pregnant. I'm taking Thyronorm in the morning. So, what will be the correct time to take iron and calcium? And there should be any particular gap between these tablets. Hi, Harini. Yeah, Thyronorm, it has to be taken on empty stomach. So, that we can't compromise. When you wake up in the morning, please take Thyronorm with a sip of water. Then, after about half an hour to 1 hour, have your breakfast. After breakfast, if you're gonna have tea, coffee, please have it immediately after breakfast, and wait for about 1.5 hours. Then, with a glass of lemon juice, you can take your iron. around 11:30 is the time that you get to take iron. After that, around 1 o'clock, have your lunch. Immediately after lunch, you can take calcium. This is ideal gap between these medications. I eat leafy vegetables and healthy food daily. Do I still need supplements? Uh, if you're not pregnant, this diet, the balanced diet should do good, but in pregnancy, it's not just the routine amount of iron that is needed. Your body needs extra for increasing blood volume to help build fetal stores. So that extra iron only supplements can help. Most of Indian women are deficient. Though your hemoglobin looks good on paper, iron stores deficiency undachu. So check with your obstetrician, get a ferritin test done that will tell us about iron stores. In case your iron stores are also rich, you're having a very balanced diet, your hemoglobin is good about 12, 13 and it's not falling in pregnancy, then you might not need supplements. But I don't think any of us fit into that category. Either your hemoglobin is on the lesser side or there is a fall of hemoglobin in pregnancy, because you are not able to meet the demand, increased demand with diet alone, or our ferritin levels are on the lower side. So most of us need supplements, and if at all you are in that lucky few who have very good iron stores, very good hemoglobin, very balanced diet that can even support your increased needs in pregnancy, in that scenario you don't have to take iron supplements. Can breastfeeding mothers continue these supplements? Absolutely. Iron, calcium, DHA are to be continued even in postpartum phase. They will help maintain iron levels in the baby also, and calcium will help maintain your bone strength. DHA in breastfeeding is given, it reaches the baby also, and it is known to improve the IQ of baby. So please continue supplements at least for 3 months iron, 6 months calcium. Are there any side effects of calcium supplements in long run? Not really. I think calcium, few of the earlier supplements, few of the earlier formulations of calcium were known to cause constipation, but recent supplements, they don't have really any major side effects. You can continue taking them, no issues. Doctor, can we take calcium and other vitamins together? Yes, you can take. Just don't combine iron and calcium. Other than that, other vitamins and calcium you can combine. You can combine calcium with ecosprin, DHA, vitamin D, multivitamins. You can combine them with calcium, no issues. Then I think I've answered all the questions. So have a healthy and happy pregnancy. For any pregnancy related queries, concerns, high risk pregnancies, we doctors at Lotus Hospitals are always available to give you the best pregnancy outcomes. Do visit Lotus Hospital, Hyderabad and Visakhapatnam. Yeah, bye.